Wonderful morning, afternoon, whatever it may be where you are right now at this time. I'm Dr. Justin Pearce. Dr. Donald Miller.
What's up, guys?
Guest, Dr. Rachel.
Hi, guys.
So today we want to talk about natural dentistry. What an important topic. You know, teeth are kind of important. You're supposed to go get checked up. How often do you get checked up? Every 6 months?
Every 6 months or so.
Supposed to do,
or
right?
More, yeah.
You know, and a lot of times, to be honest, like I was like, well, yeah, I don't want to go get more x-rays. I don't want to just go get, you know, a bunch of fluorides or, you know, look for fillings and cavities and those things. So, you know, I hadn't gone to the dentist for a long time. But I do understand that there's important things to go with, like root canals, important things with like removing mercury. But you cannot, and I tell you right now, do not just go get your mercury removed by just any dentist. Can any dentist?
It's Monday, guys. It's Monday, so
Can any dentist
hang with them
remove
here.
it? Sure. But you got to make sure they do it properly. I think that's what we're going to talk about a little bit here today. And also, there's a lot of talk about ozone. And we've talked about ozone before in the past and like what it is and how great it is for overall health and that third oxygen molecule like literally just going and bouncing and killing cancer cells and killing viruses and just healing your body. There's a lot that it can do for infections in your mouth as well. So welcome to the show.
Thank you. I'm so excited to be here.
Very good. Yeah. So you're here in Kentucky.
I am. I'm in Midway, Kentucky.
In Midway, Kentucky. So
really
for
close.
those of you around here probably know where Midway is. For those of you not, it's Midway somewhere between what is it midway between?
It's in between
Louisville
Lexington
and
and Frankfurt.
Lexington and Frankfurt.
And then also between Georgetown and Versailles.
Gotcha. So it's Midway.
Yeah.
Very good. Makes sense. Perfect. Well, Doc, what do you got?
Yeah, so I mean, you guys, we always talk about inflammation. You know, we all agree that inflammation is the root cause of all disease, and so, you know, working with Dr. Riley here and just hearing about what she does in her office, we were just intrigued because, you know, there's so many people that have the mercury fillings, and we want safe ways to remove them, and she does an awesome job with that. We're gonna have her explain a little bit about that. But even if you don't have, you know, those type of fillings, even if, you know, you overall have a healthy mouth, there's a lot of things that could be going on that can still be promoting inflammation systemically. And so again, guys, if we want to get rid of inflammation, then we've got to address the mouth, we've got to address our teeth. And I mean, it's a good thing to keep your teeth, have something to chew with. It's always a good idea.
That's the problem being in Kentucky, though. Like, you don't need all your teeth to be in Kentucky.
You fit a little better when you've missed a few. So. Oh, these California boys, I tell you.
Yep, that's right. So, Dr. Rachel.
Yeah. Tell us a little bit about yourself and kind of what got you into dentistry and more like the more holistic route.
Well, so I'm from Bowling Green, Kentucky. I came to Lexington to do my undergrad training in dental school. I've just always been interested in health in general. I was an athlete, so I was trying to optimize my own performance. So I've just always been really interested in that. And dentistry was a perfect fit for me. I get to work with people. I get to, it's very science-based. It's medical-based, and then it's also an art form, too. I mean, it's very artistic. So it was kind of the perfect blend for all the things that I enjoy.
Nice. And so what got you into wanting to do more of the holistic part of it and being, you know, with the safer removals and doing the ozone and all that kind of stuff? I
was just very concerned. I mean, personally, if I had to get a filling, and I'm always looking at what's going into my body, the products that I'm using, and I didn't understand why it was any different for my mouth, you know, especially the mouth. And the more I kind of got into that route, the more I learned just about all these different topics in dentistry that could be affecting the overall health of a person. And I just couldn't stand by knowing that information and not do something about it.
Yeah, absolutely. Yeah. Love it. I mean, you know, it's mouth's so close to our brain, you know, and these infections, these metals and all these things that we're putting in our mouth that are so-called safe, right?
Yeah.
But yet they're really not safe. And so tell us a little bit about the mercury in these amalgam fillings and kind of what your process, how your process is much different and why it's so safe as far as getting rid of stuff.
Sure. So and honestly, I didn't even know this until, I started reading about it. I wasn't really taught it in dental school, that silver fillings are over 50% mercury. They have over 50% mercury. And
crazy.
When you, like if you drop a thermometer and you spill mercury, there's like 10 steps that you're supposed to do to dispose of it properly.
Right.
But we're just putting
it's okay
it in
to
our
be
mouth.
in your mouth.
Yeah, it's okay to put it in our mouth.
Some of our listeners are probably laughing about that because when they were younger and a thermometer spilt, you come and you have everybody play with it. because they didn't know any better, right?
Yeah.
I had somebody tell me the other day, but yeah. It is. It's
I mean, it's a
toxic, crazy.
neurotoxin, and it's proven that, I mean, when you're just daily chewing, you're drinking hot coffee, you're stimulating that metal. It's expanding. It's it does damage different ways.
Sure.
But it's also releasing low levels of mercury.
And so how safely, how can you remove it?
So we do everything to minimize exposure. So the thing about removing it is you generate the most mercury vapors when you drill on it. You generate a lot of heat.
Sure.
So if you just go in and, use a drill, not only the dentist and the assistant, but the patient is also getting these high levels of the vapors. So we take several steps. If you're, the IAOMT is the group that kind of set the protocol. It's called the SMART protocol, the Safe Mercury Amalgam Removal Technique, and they're a great organization. But we use a rubber dam. If are you familiar with that? It's a piece of rubber that covers basically everything except the one, the teeth that you're treating. The patient is breathing oxygen, 100% oxygen, so that they're not getting the vapors that way. The dentist and assistant are wearing special masks that don't allow the mercury vapors to pass through. And then we have a big vacuum. We call it our elephant trunk. We named it Ellie. That basically sits right over the patient's mouth and will suction up any extra vapors that escape.
Cool.
Also using a lot of water to keep it cool.
Sure.
So we're doing everything we can.
It's awesome.
To minimize the exposure.
That was awesome. And so people are out there, and there's dentists out there that are just removing these with no harm.
And honestly, I mean, I did. In dental school.
Didn't know.
And yeah.
It's crazy.
Yeah.
And the other thing too is like, so I use my wife. Like she had some issues with her teeth.
Mm-hmm.
She's from Canada, and so it's like they got insurance, so we just like drill every bit of the tooth out and fill it up with mercury, because that's just what you did back then. And so now coming forward and being here, and this was, I don't know, 10 years ago or whatever, she started getting issues with the tooth, and so they wanted to do a root canal. Now, before we knew everything that we know today, we did a root canal. Now, what is a root canal? So they literally just like kill the tooth, kill the root, and then like kind of stick it back in there, right?
So root canal, I mean, you basically go out, you've got if you think of like a tree, and through the center of the tree, you've got your blood supply, nerves. You basically go in there and hollow that out. You take all that out, and you put, the idea is that you disinfect that middle infected part. And then you fill it with like a plastic material, or more rubber, I guess, and then it's sealed from the base and from the top.
Yeah. So we did that. The problem is then that tooth is not, it's basically dead,
Mm-hmm.
right? So now your immune
Mm-hmm.
system in your body is not doing anything to fix that. So then infections and things come into play. And so we actually went back a couple years later and had the root canal removed, and then
the whole tooth?
The whole tooth removed.
Okay.
So, and then they're like, well, what are you doing? I said, well, honey, don't worry about it again. You're in Kentucky now. So you're going to fit in just fine, get it removed. You can do implants, if you wanted to do that, because it was her back tooth, it didn't really matter or bother us too much. But at that point with infection, when infection is a concern,
Sure.
that's where ozone can come into play, yes?
Sure, yeah. So, root canals are a very controversial topic.
Sure.
And in theory, the idea is great.
Save the tooth, right?
Save the tooth, right? But you have all these and so you've got that main canal in the center that we can pretty much disinfect. But you have all these little other canals that kind of come off, and you just can't get anything in there. So if these bacteria remain, then they can repopulate, and basically you've got a low-grade infection that your body is fighting years and years and years, and that can drive inflammation. It can make you more immunocompromised.
Sure.
Yeah.
And that is something we never want to do.
Right.
So, which is why the powers of what an ozone injection can do when you're injecting into that infected area. Because like even when our kid had a he had an issue, and he was 4 years old, and we were going on a vacation. We were literally going to Jamaica the next day, and he's got this pain. So we go and we're like, we emergency need some help, and so they say, okay, fine, we'll do a root canal. Whoa, dude, my kid's not getting a root canal. Well, that's fine. We'll just do a bunch of antibiotics. Whoa, my kid's not doing antibiotics. So what do you want, sir? We're like, pull the tooth. It's a baby tooth. It's going to come back. And what we'll do is we'll go do IV vitamin C's and different things. I didn't have the opportunity or the ability to do ozone because the dentist that we had didn't have that.
Yeah.
The closest thing around here was in Louisville until we learned about you. So ozone is just amazing.
Yeah, and we use it a lot of different ways. We ozonate our water in the office. So when the water's coming out of the drill or you're rinsing your mouth out, you're getting that ozonated water. We can, and if you do decide that a root canal is for you, we can actually put the ozone gas down into the canal, so it basically infuses into the tooth and kills more bacteria than would otherwise.
So how often would somebody need to do an ozone injection if they have like infections? Is this like because it's not just one time kills it off the rest of your life. You're gonna still get it to come back and whatnot. So how often?
What are we talking in terms
So like
of
if someone had a root canal and they want to just make sure that there's no infections that's going to sit in, as far as like a maintenance thing.
Yeah. Is it like a once a year thing? They come in and do that? Is it?
In a root canal, it would probably be just the one, because you do seal it like from top to bottom, and then you put a crown. You can't open it. I mean, unless you open the tooth up every year, which we don't do. But now, if you're dealing with a periodontal disease, you've got gum disease, and we're just fighting that bacteria, that aggressive bacteria that causes bone damage and bleeding gums. That's something, whatever your maintenance intervals, whether it's every 3 months, every 4 months, we would do treatments then.
Sure. And it's ozone injections? Is that what they are doing?
Yes, so we can use the oil that you referred to earlier. We can inject it kind of into the pockets around the tooth, like if you have an area of, like a localized area of a lot of inflammation, we can do that. We can actually inject it into the gums, and then the water too.
Sure.
Yeah.
And so at the end of the night, and end of the day every time, so I brush my teeth, and then for about a minute afterwards, I actually use ozonated oil, and I put that on the toothbrush and just brush your teeth for 1 minute with the ozone oil. So what are the benefits to brushing your teeth with ozonated oil?
So ozone is gonna basically kill anything that's unhealthy, like unhealthy cells. So you're going to be, it's antifungal, it's antibacterial, it's antiviral. So you're going to be fighting that bacteria that cause gum disease,
It's connected. So
yeah.
And then too, we also have specific. I know you guys use probiotics here. Specific oral probiotic, because while I love ozone.
Yeah, we can hear that.
I'm back. Had a little break there. Didn't want to blow my nose in front of everybody, so hold on, Dr. Riley. So I forgot we have new mics, and it follows me, so you probably just got a schnoz blow. So it keeps you guys entertained a little bit. So
ozone is going to kill your good bacteria and your bad bacteria, because it's going to kill everything. So we also have a probiotic that it basically, you let it dissolve in your mouth. So it's going to populate your mouth with the stuff that you want there, and can kind of keep the bad bacteria at bay.
Yeah. Again, gut health is very important when it comes to oral health as well. Part of it is stop putting the crap in your mouth to mess your gut and your teeth up at the same time. But that's a whole nother topic for another day. There's just never a quick fix. You got to take care of yourself. You got to take care of your teeth. It should be routine that you brush your teeth. How many times are you supposed to brush your teeth?
I mean, I like to say twice.
Twice a day.
So
if I do it in the morning twice, I'm good for the rest of the day?
No. I like once a day a really good disinfection of your mouth. And it's not just your teeth. I mean, you've got your tongue. I want you to go in between the teeth. And we go over that in depth. A lot of people, nobody ever taught me how to brush my teeth. I mean, you just do kind of what you see. And then
sing happy birthday a couple times.
Yeah, exactly. So we go over like completely cleaning your mouth once a day, and then more as needed.
And some people need a lot more.
Yes.
Well, that makes me feel good. So I'm still doing good, brushing my teeth once a day. So we're on point.
I've got work to do. No. It's something I definitely recommend you guys look into is the ozonated oil for brushing. I think it's just amazing. It lasts for a very long time. But again, if you get infections, if you have issues, and the dentist is just telling you that you got to do root canals or you got to do antibiotics, I'm telling you, there's so many more options out there, and reaching out to a more holistic type dentist that can give you ozone injections to fix the infections, as well as take the root canals and take care of them. Maybe you don't need a root canal. Maybe you just need to get the tooth removed, or the ozone can kind of prevent you needing that root canal as well from time to time. But again, everybody's different, and it just depends on obviously patient to patient. So one thing with the mercury too, in getting those removed, I always like to tell patients, like, leading up to going into this, like, you want to kind of get your gut ready. Sure. As good as she's going to do to make sure that you're not breathing in or like swallowing any of the chips of mercury or whatever, there might be some things that just get through just because it's going to happen. So to be able to bind yourself and have a bunch of binders like activated charcoals and things kind of before, during, and after, I think is very important as well. And I think you would agree with that, yes? Absolutely. Okay. Very good.
A lot of your sulfur-containing foods too. Sulfur will bind to the mercury really well. Yep. So we talk to them about getting your veggies in before you come. Yep. And then we also suggest chlorella too.
Okay. Oh, yeah.
With the activated charcoal.
Very good. Yep. Very, very good. Yeah.
So, we talk about gut health a lot. We talk about the type of stool testing that we do, looking for any kind of bacterial overgrowth and just, specific things, any kind of microbes that should not be in our gut that are keeping our immune system flared up. So tell us about this analysis you do with all your new patients, looking for, these possibly problematic bacteria in the mouth.
So bacteria in the mouth have been linked. Well, they're being linked to more and more disease. There's an actual study out there that shows that the bacteria in the mouth can cause a heart attack. Some of the toxins in certain bacteria are being found in the brains of Alzheimer's patients. So we know that the bacteria is going other places. Yep. These bacteria typically, they're either going to live where you would have like an abscess in your tooth at the end of the root, or down in your gums, like where you can't brush and clean. So we go under the gums and take a little sample. You don't really feel it. It's not painful. And we put it under the microscope and look to see if we see any of the high-risk kinds. Now, we can't know the specific strains just based on the microscope, but if we start seeing spirochetes, if we see white blood cells in your gums, if we see amoeba, we know there's an infection there. Now, depending on the specific situation, we can actually send those samples off and find what exact strains that you have to basically fight them and get those out of your body. And then we have other measures in the office too, like the ozone, to treat the bacteria. Yep. Yeah.
So you guys, just like our motto in this office is we don't guess, we test, and that's exactly what Doc's doing with her patients. These bacteria in your gut could be there for years before it actually becomes symptomatic. Mm-hmm. And so, we're all about being proactive instead of reactive, and that's what Doc's all about in her office. Like, I'm not going to wait until this bacteria causes a problem. With all my new patients, she wants to make sure that these underlying conditions aren't happening, so that if they are, she can get on it right away. So again, it doesn't lead to some other periodontal disease or, abscess teeth, to the point to where now your teeth are starting to rot. And that's why we love her office so much, is because it's all about getting down to the root cause of the inflammation, right? And so, I don't have any symptoms. Well, that's great. I'm glad you don't. Let's not wait till you are symptomatic. Yeah. Let's not wait till you have an abscess tooth. Let's not wait till you have a major issue. Why don't we go ahead and do the proper testing now to rule those things out? And I think that's fantastic. Yep.
And one thing to play, so some people, like, a tooth will die and they are completely asymptomatic, but they have like a chronic infection because if there's a way for it to drain, if it's an upper tooth and it's draining into the sinus, you'll never have pain. You will never have pain, but it's there. So we also do the 3D X-ray if patients want to basically look for any hidden infections that they may not be feeling at the time, but they're definitely there.
Yep. Awesome. Makes sense. It's just, again, it's something different, and you've been going to your dentist for 20 years or whatever it may be, but you got to look into it something different. Infections. I was reading a study that said like 90% of cancer patients had root canals because they have infections, like she was just talking about. You have infections, but you didn't have tooth pain. It was going into your sinus cavity, and then it was spreading into your bloodstream and getting into. Now you got bone marrow cancer, and you're wondering what the heck happened for. Well, you had all these infections in your mouth, and they were seeping through there. So it's so important to take care of your health, of your oral health, well, hell, of your health in general, right? You got anything else? I got a question for her. So.
Yeah, I do. I got one thing. How do you think about? How do you feel about oil pulling?
Yeah, that's a good one.
It's interesting. I haven't read a lot of studies that, scientifically, I haven't found, proven that that it helps, but I've had a couple patients that have honestly really had good results with it. I mean, really good results. So I would not discount it at all.
Yeah, I mean, we're big on oil pulling.
Hurt.
You know, I mean, pulling those toxins out of your mouth. You know, with a good quality oil, coconut oil, something like that. It's really good thing. Really effective with a lot of people.
Oregano oil is really great
Yep.
to kind of get that, it can kind of help with those infections.
Sure.
And also lemon oil, because I have a lot of lemon oil. I was on like auto ship for like a year of lemon oil. So if you need lemon oil, let me know.
And if you want to sell lemon oil, talk to him. He's looking for a couple.
Yeah.
So.
It's all, lemon oil is really great for teeth whitening as well. So oil pulling, great. But again, the rules on oil pulling, if you've watched or heard us talk about it, do it for 10 minutes. It kind of shuts you up so you don't get talking to anybody. So that's sometimes good for someone else. Can't sing in the shower. That's also good. But do not spit it out in the shower. Do you know why? Post right now, tag right now, write right now, comment right now if you know why you do not spit the oil out of your mouth in the shower. And we're going to come back to that.
And for a whole different reason, you don't spit it in your toilet either. So there's two different answers there.
Yep. So we want to know that.
Then we got something to give away. If you can get it right.
And then so I look forward to hearing that answer. Now, my question to you, Doc, is
It's going to put you on the spot.
If you had 3 things that you can give our people right now that they can do to make sure that they have good, long-lasting oral health, what are the top 3 things to do so that they can take care of their health today, for the future, and so on?
Come to Midway Family Dentistry. That's the first
thing.
thing.
There you go. I like that. Top 3 things.
Top 3 things.
Well, I'm going to say brush.
Brushing's kind of important.
Brush your teeth. I mean, I don't think you have to have a big fancy electric brush. It's going to do a good job, but just brush your teeth and clean them.
So is an electric toothbrush better than a regular toothbrush?
Yes. I mean, it's going to do more. It's going to do more in 2 minutes than you're going to do in 2 minutes. So it's
I can do a lot in 2 minutes. So yeah, okay. I know what you're saying.
Okay.
So electric toothbrushes, good.
Okay.
All right.
And then I'm going to say clean in between your teeth. So a lot, and I'm not a big. If you don't want to floss, that's fine. But my favorite tool is the little interdental picks. They're going to stimulate your gums more. But getting something in there to basically disrupt that bacteria so that it doesn't stick on the teeth and form a community.
So not just the ones that have like the toothpick with the little floss thing, but just the
they're
little
called
things that you
soft
just stick.
picks. They're like GU gum brand. They're green, and they have like a little brush on the end. So you use them like a toothpick.
Cool.
Most people, when you start using them, you're going to see a lot of bleeding, and that is just showing that there's inflammation in your gums.
Sure.
But the more you use them, then your gums get healthy, and you can use them daily, and you know you're not going to see bleeding.
Yep.
That would probably 2, and then.
Come on, the third big high level one. Here it is.
3. Yeah, I mean, see your dentist regularly and find somebody that's going to care about your overall health, and find somebody that's going to listen to you, you know, and take your needs and your goals into account, and do what they can to prevent disease, because oral disease can be prevented if you want it to be.
You always compare like chiropractors and dentists, and it's kind of the same thing. Like, you don't go to chiropractors, you've got a problem.
Yeah. I mean, it's true. We preach it about your spine. A lot of people are like, well, I don't need to go see a chiropractor. I don't have any back pain. So we're all about maintaining your lifeline. Your lifeline's housed by your spinal column. If your nervous system was in your thumb, we'd be working on your thumb every day, right? But God protected it with your spinal column. And so, your teeth, same, a lot of people, they do nothing about their teeth until they got issues, right? And once you got issues,
it's too late.
It's too late, right? Like, now we're going to start pulling teeth. Now we're going to start doing things. And so, just like we say you need to maintain the health of your spine, same thing with your teeth. You got to, you got to put in constant effort. And the cool thing is you can do a lot of things at home.
Sure.
Well,
if you only come twice a year, you've got 363 other days that you've got to, do something that, and just seeing me twice a year isn't going to keep your teeth healthy for a lifetime.
Yep.
Right. Yep.
Yeah.
I highly recommend the ozone oil to add into your brushing regimen too. I think that's just something that's really great. I've seen some great changes in that as well. But yeah, man, I think there's something for local people that you want to maybe tell them about you and give them a little offer?
If you guys want to call the office and we can do a free initial consultation, I'll sit down with you and I can answer any questions, talk to you about your goals, and we can discuss maybe if I have any recommendations for you as a dentist.
Yeah. So if you do that, what we'll do is we will put her contact info. We'll put it in the chat right now, so if somebody can do that, and as long as you call in there and just say you heard her on Millpond. So code is Millpond for your special treatment session. What did you offer?
Free consultation.
Free consultation. Special free consultation with the doc for her to find out, what's going on. I've seen some people say, my dentist is retiring, or I just got some stuff going on, or I'm looking for something different. She is that something different and can definitely help you with that. So reach out to her if you have any questions. If you need any help with us, obviously let us know. But as always, we appreciate you guys watching, and we will be talking Wednesday a little bit more. I have a cool topic. I think I have something fun planned on Wednesday that I think you guys will definitely not want to miss. So make sure you stay in tune, like this, share this, please comment, and also I guess we did anybody write anything about why not to spit the oil pole?
Yep, they got it right. So Andrea said you'll slip and fall. Nancy says it'll harden in your pipes.
Yep. And not only will you slip and fall, but you will slip and fall on your butt so hard. It is
that
slippery.
You'll need to come to the chiropractor.
That needs to be in here, so maybe they should. No, guys, be careful with that, and just be careful spitting it down your sinks. Just spit it out. Spit it in the trash can. You got it right there in the bathroom. Make sure you spit it out. A lot of benefits to that. Love doing it in the morning while you're in the shower, getting ready, because that's just the perfect time for you to just relax, think about your day, and just get your thoughts and mind right. So, thank you for watching, and see you on Wednesday.
Make it a great week, guys.